biggest thing is because it's totally a new field, a different field, and so there will be always we get into that negative mode that I mean it's impossible to read because each volume is runs into 2000 pages, 2500 pages. So that fear will be always there. I may not able to read these volumes repeatedly. So these challenges actually you can overcome by self-confidence. Always you should look, there are already doctors who are are our own teachers who have reached that position. So they have also gone through courses like this. So one should have self-confidence, and that should motivate you to perform better. And at the same time, one of the best way of learning in medicine is by interaction with your friends, your own fellow students. Today, the most important aspect of medical profession, apart from your knowledge, apart from your expertise, is how you really interact with patients and how you interact with the patient's attenders and how you manage the circumstances and the environment where you are treating. That is very, very important. So you might be treating patients well, or you might be exercising your professional expertise to a greater extent, but what patients want is how we interact with them, how we try to infuse confidence in them. So then only they develop a trust. So one should not treat patients as equipments or instruments. I think even patients and their attenders are flooded with loads of information. So they want to ask, clarify a lot of things from us. So we need to clarify why not this, why this has to be done, why it should not be done this way. And one should have patience, that is very important, and you should spend a few minutes with the patients and you should listen patiently to what patient says for at least 5 minutes. My philosophy is no patient should go untreated for the want of money. That is my. At the same time, a quality treatment should be given to all sections of the society, irrespective of financial affordability. That is one. And another important thing is I always try to inspire and motivate my younger colleagues. Suppose if more and more specialists at junior level, if they are prospering well, I am the first person to acknowledge their achievements. I am the first person to really put them in proper places. I think, see, there was a time because I was offered a consultant job in some private hospital. Of course, the remuneration what they were talking about in a private hospital is 5 to 10 times more than the salary what I am getting. But at that time, I think it was my wife and my father-in-law. They told, okay, if you leave this government job, you may be earning many times more, but we lose an opportunity to serve the poorest of the poor. A common man in this hospital gets a 5-star treatment at an affordable cost. So that gives an utmost satisfaction. Another thing that gives me immense pleasure is my interaction with postgraduate students, because whatever knowledge we have acquired and acquiring daily, so that is passed on to the next generation of specialists or cardiologists. When we publish some research articles in national, international journal, that gives a lot of satisfaction, because we cannot be in this profession, for generations and generations, but our research and our publications in various national, international journals will keep us alive for centuries together. I think when we are convinced by doing whatever procedure, if he is not going to survive, discuss these issues with the family. I think there is no point in wasting money on this. Then you should, because knowing fully well that patient is not going to survive with any amount of treatment, we should not try to really squeeze this thing. So of course, just because so many investigations are available under the roof. So for every patient, all unnecessary investigation should not be done. So this is very important, because not only these operations or investigations are not useful, in some situation it may be harmful.